Hello, everybody, and thank you so much for joining us for one of our weekly Fortune 500 focused webinars. My name is Sam, and I will be your moderator today. And in just a minute, we're going to be joined by Tyson Mavar, one of our financial advisors here. In today's webinar, you're going to learn how HSAs can unlock significant savings on your medical expenses, and Tyson will also explore the tax advantages and spending flexibility offered by HSAs. And if you stick around after his presentation, Tyson will also be answering some of your questions. But before he comes on, I'd like to just quickly remind you that we are not affiliated nor endorsed whatsoever by any specific company, though we work very closely with several clients and potential clients of several Fortune 500 companies. We are not affiliated nor endorsed whatsoever by any specific company, so please keep that in mind as you're listening along. And after the presentation has ended, you will be redirected to our homepage where you can book an appointment to speak with Tyson Mavar himself or one of his colleagues if you wish. So take advantage of that. And without further ado, here is Tyson Mavar.
Thanks, Sam.
Sure.
Good afternoon, folks. Thank you for attending our webinar series today. My name is Tyson Mavar, one of the retirement specialists here at the Retirement Group. And on today's webinar series, we're going to be talking about health savings accounts, HSAs, one of the better parts of the tax code, especially for retirees, for reducing your taxable income, for saving for healthcare expenses in the future, and for investing money, honestly. Today, we're going to talk about some of the rules, some of the income limits, some of the benefits, and other considerations that you should know if you're somebody that's either looking to reduce your tax bill or save for future medical expenses. We're going to talk a little bit about the ins and outs of the HSAs, some of the tax advantages. It's actually a triple tax advantage. We'll talk about how that works. And then we're going to get into how much you can contribute, as well as some of the opportunities for growth and investment within these accounts. So what is an HSA? HSA stands for Health Savings Account. It's a personal savings account that can be used toward healthcare costs. And there's a lot of rules that come around this because of all the tax advantages that go with this. But I can't tell you how many times I'll talk to somebody for the first time and find out that they weren't even aware of HSAs. They didn't know how they worked, or mainly they weren't contributing to an HSA and taking advantage of this. And if you can afford to save, chances are you're going to have medical expenses in the future. This is a great way to save for them. And because it's not use it or lose it, like flexible spending accounts, the FSAs are, it's a very good way to save, even if you don't have current medical expenses. For instance, if you are a young person that rarely goes to the doctor, chances are you're going to need money for healthcare costs one day. The triple tax advantage relates to the tax deductible contributions. When you put money into an HSA, it reduces your taxable income for the year up to a limit, which we'll talk about in a moment. Your investment earnings, if you decide to invest these funds, which you don't have to, but especially if you don't plan to touch this money for a while, especially if you're young and a ways from retirement, you ought to at least consider investing this money because of the tax advantages. There's tax-free growth on the investments as long as those dollars are used for qualified medical expenses sometime in the future. And then tax-free withdrawals, once you pull the money from the account, as long as you meet certain requirements, as long as these are qualified distributions, you pull the money out tax-free later in life. And it doesn't have to necessarily be later in life. You could put money into an HSA and use that money this year. But if you don't use the money, we would recommend continuing to invest that money for future years because, again, most people don't oversave for healthcare costs. It's typically the opposite. And healthcare costs are one of the biggest concerns we hear from our clients who are approaching or in retirement already, is the cost of medical insurance or just healthcare costs in general. And one of the reasons a lot of people continue working is because of this biggest concern that they have related to their medical and the implications it's going to have toward the sustainability of their retirement plan. Now, let's talk about the contribution limit. So for 2024, for an individual, you could put up to $4,150 per year, tax deductible, of course. For families, up to $8,300 per year if you're on a family plan. And if you're over 55, you can put an additional $1,000 in this plan. So they call this a catch-up contribution, but remember, catch-up contributions for your IRA and 401ks is at 50. For HSAs, it's actually 55. So a little bit different, common misconception that we see. There's no a minimum. If you open an HSA, you don't have to contribute to it. But you do have to have a qualified plan that allows for HSA contributions. And typically these are high deductible health plans. Not always, but usually high deductible health plans. We're going to have an option to start an HSA, contribute to an HSA, and these accounts are also transferable. If you leave your employer, there's a different administrator. You don't have to transfer those accounts typically. You can leave them in Fidelity if that's where your old 401k plan is, and your new 401k plan is a different administrator, but they're very flexible in that sense. So let's talk about the investment opportunities, the covered expenses, as well as some of the additional benefits that come with these flexible health savings accounts. So what type of medical expenses? Most medical expenses, copays, deductibles, ongoing medical care, exams, physical exams, x-rays, hospital care. A lot of different expenses are covered or available for HSA withdrawals that will be qualified. Dental expenses are covered. Vision expenses, for the most part, are covered. There's some additional expenses. One of my clients found it interesting to find that you could actually pay for wellness and substance abuse. So mental health issues are qualified in many cases for withdrawals from an HSA. Age 65 is very important for HSAs, and primarily because that's when you qualify for Medicare, and most people sign up for Medicare because in most cases there are penalties for not signing up by or nearly after your 65th birthday. 3 months after is when we recommend our clients sign up for Medicare. Even if you're still on a plan, they recommend signing up for Medicare Part A, which doesn't cost money at 65. And the unfortunate part about this is that you can no longer contribute to an HSA once you are enrolled in Medicare. You don't have to spend your HSA money. You can continue to use your HSA money. You just can no longer fund the HSA at 65. So keep that in mind. That is one of the detriments and one of the milestones of 65. But there's also penalties associated with pulling money for non-qualified expenses out of your HSA prior to 65. And those penalties go away after age 65. So key milestone, age 65. Now, with investment opportunities, most HSA providers will allow you to invest the dollars that you're waiting to spend inside of an HSA. I have clients that have an HSA both at Schwab and at Fidelity that they're investing that money. And typically people will invest that money relatively aggressive if they don't expect to spend it in the near term. Many people will have it balanced similar to their 401k plan where there's some short-term, more conservative investments just in case they need money soon, and more long-term earmarked money that is a little bit more aggressive, maybe invested in stocks or stock mutual funds with the anticipation or hope that they'll get more growth on that money and get an even better tax benefit from contributing to this HSA. And we're going to go through some examples here of how this can help you based on somebody who contributed to an HSA versus somebody who did not take advantage of the plan. So first we have Alex, who has an HSA. She contributed $3,500 to her HSA through pre-tax payroll deduction, so automated through her employer, just like the 401k contributions are. She's in a 25% tax bracket. She saves $875 in federal taxes based on this contribution, deducted from her tax return, $3,500 of income. Her employer, which is the case with many employers, also contributed an additional $1,000, sort of like a match to her contributions to her HSA. There was investment growth. In this example, we assumed 5% annual average return on investment. This is a fairly conservative assumption on growth. possibly could get higher. With interest rates higher now, even more incentive to invest these types of accounts because you can earn more interest even in a safe environment. And qualified healthcare expenses throughout the year amounted to $2,500. And she was paying all of this through her HSA, which created tax-free withdrawals. Her out-of-pocket costs amounted to $1,500 in deductible, and all of this was also paid on a pre-tax basis. So she reduced her income by contributing to the HSA, and she was able to spend that money tax-free. So it's like that income was never incurred from a tax perspective, at least. Then we have Jordan, who does not have an HSA. Jordan paid $3,500 in healthcare expenses from her after-tax income. So it did not get the tax deduction here. Because Jordan's in a 25% tax bracket, she needs to earn about $4,667 before taxes to cover the same costs Alex does with pre-tax dollars. A big tax bracket advantage. And the higher your tax bracket, the more advantageous these HSA contributions become. Furthermore, tax benefits for Jordan, because she paid $1,167 more taxes than Alex based on her tax bracket, both of their tax brackets being the same. There was no investment opportunity, so no tax-free growth on earnings because there was nothing in this account to begin with. And the same healthcare costs were still incurred, the $2,500. They were just more expensive because there was no tax benefits associated with these expenses. So Alex, because she saved by reducing on taxable income through her pre-tax contribution earnings tax-free interest and making tax-free withdrawals for qualified expenses. Jordan does not enjoy any of these tax benefits. Jordan did not enjoy any of the investment growth tax benefits either. There was no portability. There's nothing for Jordan to roll over because there was nothing contributed. So there's not money building up over time, even if there was no healthcare costs incurred. And for out-of-pocket costs, there was obviously no tax benefits for Jordan either, whereas Alex was able to pay her deductible with some of the money that she had put into her HSA that year. So there are some limitations. We talked a little bit about the high deductible health plan. Most high deductible health plans have HSAs, not all of them. And not all plans with HSAs are high deductible health plans, but most are. So when you do your enrollment later in the year, or if you have a special enrollment period, this is something to look for if you're not contributing to an HSA. Is the HSA available? And that's usually going to be an option, one of many options in your booklet. And like we talked about earlier, high income earners have an even better benefit. If you're in the highest tax bracket at 37%, you're going to get a 37% per year tax benefit, or 37 cents for every dollar that you save into this plan, up to those limits that we spoke about earlier. Now, we far too often run into people that aren't planning for their retirement, so they don't even know about some of these tax benefits, and you don't know what you don't know. So it's very important to plan, and unfortunately 74% of Americans over the age of 50 don't even have a written plan for their retirement. Don't be a statistic, folks. We will put one of these together for you for free. It's called a retirement cash flow analysis. This is our way of getting to know you and allowing you to get to know us. Just in case you decide to use an advisory firm in retirement, we're very confident that you're going to have a good experience spending some time with us, and that you might consider doing some business with us when the time comes, which may be at retirement, and it may be even before retirement. There's a number of reasons to consider our company. I'm not going to go into the details. I'd recommend that you just schedule a call with one of our advisors just to talk about your situation. It's not going to be a high pressure situation. Our biggest intent with these meetings is to improve our reputation so that we can grow our business through referrals. And if it just so happens that it makes some sense to do business with us, we'll tell you about the costs of doing so and the additional services that we offer, other than just assistance with the planning, the investments, the tax and distribution strategy. There's some of the other ways that we can make your life easier as you approach retirement, and certainly after you enter into retirement. I think we have some time for some questions, Sam. So if we have any, go ahead and ask away and we'll see if we can get to them all.
Thanks, Tyson. Great. There's so many benefits to HSAs. I can't believe that, such a big group of people don't really take advantage of those.
Me neither.
Alrighty, first question. What happens to my HSA if I no longer have a high deductible health plan? I think you talked a little bit about this, but
Yeah, nothing happens to it. The money's still there. You can still use your HSA card. You just cannot contribute to that plan anymore. And if you opened or started a new plan with a different employer, or maybe you've got private insurance, you could still start another HSA plan. But the good news is you can still use the funds for qualified expenses, of course, on that HSA that you originally started.
All righty, thank you. Next one. How does contributing to an HSA affect my federal income tax return?
It's going to be a dollar for dollar deduction of your income up to the limit or up to what you put in. So if let's say you had gross income of $100,000 and you put $4,000 into the HSA that year, you now have taxable income of $96,000 because of that contribution.
Nice. Alrighty. And this is going to be the last one, Tyson. Is there a penalty if I use HSA funds for non-qualified expenses before age 65?
Yeah, great question. I don't think I talked about the actual penalty. There is a penalty as well as taxes. If you just pull money out of your HSA before 65, that's a key milestone because the penalties go away if you pull money out for non-qualified expenses after 65. The taxes don't go away, but the penalty is 20% on top of the taxes if you pull money out of an HSA prior to age 65 that's not a qualified expense. It's not a qualified healthcare expense. So be very careful of that. Be aware of that. Hopefully there's other sources because of how valuable this money is. It's like we talk about how valuable Roth IRA is to our clients. This is like some of the most valuable dollars in your retirement plan. So avoid using them, and certainly avoid using them for unqualified expenses you're going to have to pay penalties for because of how much value they can bring to you and your family now and in retirement.
All right, Tyson, that was it. Anything else you wanted to add?
I think we covered a lot, Sam. Thanks for the help today. Everybody have a good, safe rest of your week, and we hope to talk to you all again very soon.
Thank you, everybody. Enjoy your day. Thanks, Tyson.